So, good afternoon. Today, we are honored to have a very insightful discussion with Dr. Ashish Jain, a leading interventional pulmonologist, director and head of the Respiratory Medicine, Department of Respiratory Medicine. As the Delhi winter approaches, the city faces a dual challenge: the dropping temperature and the rising pollution levels. These conditions create a perfect storm for respiratory issues, making it crucial for everyone to take proactive measures to protect their lungs. So today we are having Dr. Ashish Jain, who
Thank
is
you.
a director and head of pulmonary department, Saket. Dr. Jain, please enlighten us with your important reviews.
See, the problem is that, every year after year, we are facing this kind of a problem that during winter season, because of the drop in temperature, because of the drop in humidity, because of the drop in, the air speed, the wind speed, the pollution level it rises. Plus, during the winter season, we also tend to use more of electricity, more of vehicles, more of generators, more of wood combustion. So all these things are there. That leads to generation of more pollution, as well as during this time, the because of the weather condition and because of the geographical nature of this piece of land, we have an issue, and the pollution level they rises. So um, so that is the whole problem right now, and therefore the pollution levels they rise a lot.
So we have some questions, Dr. Ashish, as to explain our audience what measures we can take on what is the pollution quality in our region. So can you explain why air pollution levels tend to peak in Delhi during the winter?
So during the winter, as I explained, because of the geographical nature of the city, we are on one side is the Himalayas, on the other side is the Vindhyachal. So it's sort of a landlocked area. The entire northern India is a landlocked area. The breeze is less, the wind speed is very less. The temperature drops down, the humidity also drops down, and the pollution level rises. So it's not swept away, which is the condition in, let's say in the monsoon time when there is a strong wind. So it sweeps away all the pollution. But that is not the condition here during the winter season. And that's why, the pollution levels, they rise. And therefore you see, higher AQI levels here in Delhi.
Okay, so what are the main pollutants in Delhi's air during this time, and how do they affect the lung health?
So there are some primary pollutants, there are the secondary pollutants. Primary pollutants are the ones which are generated by automobile, exhaust, by factories, and by, let's say, construction and fire and stuff like this. So these are the primary pollutants, and then they react and cause the secondary pollutants. So everything is harmful, or most of them are harmful. The predominant things are like PM 2.5, PM 10, the sulfur dioxide, the nitrous oxide, the CO2, the carbon monoxide. These are sort of primary pollutants. And then the higher particulate matters and the ozone is secondary pollutants. So these are the things. Plus, the pesticides that are sprayed on the plants and in the farms, the sort of deodorants and the CFCs that we do. So all these things add to the levels of the pollution, and then it causes
very minor things, but very enlightening. Yeah. So, what are the health risks? What are short-term and long-term health effects for breathing in polluted air, especially during the winter season?
So, what happens is that, when you inhale these toxic elements, when they go in your lungs, there are two or three things that happen. Number one is there are certain chemicals that affect your skin, that affects your eyes. You must have experienced that during winters when you go out, your eyes starts burning,
Yeah.
right? So they have got a direct effect on your eyes.
I would
That
like to
is
add here, sir, like are certain groups like children, the elderly, or those with pre-existing conditions more vulnerable to?
Yes. So what happens is that let me finish the first one. So what happens is that there are these elements, or there are these toxic gases that affects the skin, the eyes. So and then when you inhale them, they have the direct impact. They cause a lot of sore throat, coughing, and then they get into these lungs and cause the asthma or the worsening of COPD. Then some of them, they get into the blood streams and then circulate all over the body. So therefore they are responsible for heart attacks, these strokes, and the other thing. Apart from this, what you get is generalized asthenia, because you're not breathing fresh air. You feel fatigued, you feel tired. And then there are some the psychiatric problems also, like depression, anxiety, restlessness. All these things also contribute to because of the pollution. Because of the increased living in the increased pollution level, cause all these things much more as compared to when you're living in a healthy environment. As you said, that are the children's or other vulnerable age groups are more prone to this? Yes, they are. The these the extremes of ages, the children as well as the elderly, the pregnant females, they are more vulnerable to
Higher risk
these
than they are.
to these toxic elements, because their body is not prepared. Plus, the childrens are more vulnerable because in their growing phase, when these cells are repeatedly or they are generating fast, if they get a polluted air, then they have got a long life ahead. Similarly, the case with the pregnant females, the unborn child, they face the wrath of these pollutions day in and day out. The elderly, they have a lot of comorbidities, like they already have diabetes, blood pressure, rheumatoid arthritis, the COPD, the asthma, the interstitial lung diseases. So all these diseases, they are aggravated when they are exposed to the unhealthy environment, or when they are breathing constantly in a higher AQI level. So these patients, they are very vulnerable.
So, what are the preventive measures for this? Like, what steps can individual take to protect their lungs during high pollution days in winter?
So during high pollution days, one must make sure that, number one, you must not venture out in a visibly polluted atmosphere. Like on a these days during the winter, walking close to the roads where the vehicles are moving, or where there is a visible dust or around the construction site. And that's precisely the reason why the government shuts the school down during these days. So do not go in the visibly polluted area, number one. Number two is uh, you know you have to exercise, you must exercise to keep your lung healthy, but try and avoid exercising uh, when there is no sun in the during the day. So early in the morning, late in the night, please don't exercise. Because the temperature drops further during this time, and the particles, they tend to settle down further. And so the AQI is much higher as compared to during the day when there is a sun. And sun also tends to neutralize some of the harmful effects of this. So exercise during the day, and masks, I don't think that they are going to help you, but one must try to stay
Yeah, my next
indoor.
question was about the
Yeah.
mask. Yeah. So are there any specific indoor air quality measures that can help reduce exposure to pollutants?
So you must remember one thing, the indoor air quality is far worse than the outdoor air quality, right? And this is sometimes some people, most of my patients, they tell me, sir, hum to ghar mein hi rehte hain. We just live indoors.
Yeah,
So
most of the people,
yeah. So how is the pollution affecting us? The indoor air quality is far worse as compared to the outdoor air quality because of two reasons. Number one, the outdoor air in any case is coming inside your room, so you're breathing basically the same ambient air that is out. So the same pollution levels are inside one. And number two, you're adding to more pollution within the house, like kitchen fumes, right? When you're cooking, the oil fumes, the agarbattis, the dhoop battis, the paint, varnish, nail polish remover, perfume, cigarette smokes, pets, dander, pets' hairs, the dust that is deposited on the carpets and the furniture. All these things add to the already dirty air. So living inside is, you don't have a choice, but you can't just keep your doors and windows shut and let not the air, outside air, come into the this. That doesn't happen, that cannot happen.
Naturally.
But yes, and that's when people they are putting in a lot of air purifiers and all, so that they can at least cleanse the inside air. But there's a limitation to which the amount of air that you can clean.
So my next question would be based on this, like how effective are masks in protecting against air pollution and which types are recommended? And same goes with the purifiers also.
So masks, I think masks for general public, I don't think that they're going to help.
Okay.
The kind of loose masks that we have, they don't help the general public. But yes, there are certain circumstances, like if you are around the construction site, if you are in a visibly dusty or polluted atmosphere, then probably tight fitting N95 masks can help you. That is one. Number two, if you, as a general public, if you have to, let's say, go out for walk, or if you are going through a visibly dusty area, then a dupatta or a handkerchief is as good as any other mask for some time. So, and then after that you can wash it, right? So that can help you. As regards to air purifier, I told you that the indoor air pollution is much higher or much worse as compared to the outdoor. So especially the extremes of the ages and the pregnant females, those who can afford to stay long in a single room, like young newborn babies, like young kids, like elderly people, and obviously the pregnant females, and because these are vulnerable groups, they if they can stay in the room or within the house with the air purifier on, why not? I think one can do that.
Sure, just give us some points on, are there any specific lifestyle changes or dietary habits that can help strengthen lung health during this season?
Yes, so living healthy is very important. Ultimately, it is your own health and your own immune system that is going to, fight against the pollution, right? That is very important. Uh, so there are a couple of things that you must do. If the doctor has not specifically asked you not to take, then you must follow this. For example, if you don't have a cardiac problem, if you don't have a kidney problem, if you don't have a specific liver problem, you please always ask your doctor what are the things that you can eat. But I would strongly recommend, if you can drink plenty of water. A hydrated body is an immune body. The immunity levels are much higher in a hydrated body. So drink plenty of water. If you're not suffering from kidney or liver or heart disease, or if the doctor has not advised you not to take this, then please drink 3 to 4 liters of water every day. It flushes out all the toxins out of your body, and helps you recover faster. One. Two is fresh fruits and vegetable. The God has given us so many fruits and
Seasonal
vegetable,
fruits, yes.
seasonal fruits, which are um, fortified with minerals, vitamins, antioxidants, and whatnot. So anything and everything that can be eaten raw is the best thing, right? So I would always advise you pick up three different colors. We have got different colors. We
Yeah.
have got plum, we have got orange, we have got banana, we have got cucumber, we have got beetroot, different colors. Pick up three different colors every day and eat raw. Pollution or no pollution, you must do this.
More
The
colors
third
add
thing,
to your dietary lifestyle.
yes, more colors to your diet to add more colors to your life.
Yeah, right. I agree
The
with that.
third thing is one must practice yoga. Obviously, some people are more the gym person and they can do, cardio and other gym exercises, good for them. But yoga gives you flexibility and also it increases the immunity of your body. So I would strongly recommend if they can do at least 3 days, 1 hour yoga, and the rest of the other 3 days they can do their running or but some form of the exercise is very important and they must do this.
Okay. So dealing with respiratory system, like what are the common symptoms of pollution related to lung issues and when should one seek medical attention? What are your points on that?
So the common respiratory issues are a lot of sneezing, cough, cold, stuffy nose, pain in the throat, and then some people may get a little low grade fever also. That is only because of the pollution. Although during this season, the viral fever is also very rampant. It is very common. So that adds to the problem, right? And and breathlessness,
Yeah.
right? These are the most important common problems. Plus, apart from this, I have discussed that there is, the BP may also go up, the blood sugar may be fluctuating, and the anxiety and the depression and the restlessness, other things.
So what one should take, like preventive measures for controlling this?
Preventive measures for this is again the same thing.
Breathing difficulties if someone happens.
Yeah, so
Faces.
okay. So preventive is the same.
Good.
Eat good food, drink plenty of water, yoga, and avoid visibly dusty things. That is the prevention thing. For uh, patients who have these problems like throat pain, cough, breathlessness, and burning eyes, and this. So number one is wash your face regularly, multiple times a day. So all the pollutant that is absorbed on your skin, which is going inside your body, at least get rid of that. So that contact dermatitis and the other stuff, they'll be taken care of. Number one. And number two is still, if you have this breathing problem, then one must consult the doctor. Usual anti-allergic medications should be fine in most of the healthy young, otherwise healthy young individuals. For those people, those who are in the vulnerable age groups and those who already have COPD and asthma and are on treatment of COPD and asthma for their breathlessness, right? They must consult their doctor and the doctor may ask them to increase the frequency of the inhalers, right? Similarly, those who have the cardiac problem, they must ask their doctors, and the doctors may want to titrate their medication so as to bear with this new onslaught of the pollution.
Okay, Dr. Ashish, I am very inquisitive about knowing like these days the new generation is too much into hookah and vaping.
Oh my God.
And like these things. What's your say on that?
Hookah and vaping, these apart from smoking, they are a different kind of a pollution. This is societal pollution, as I say, this is polluting our society. Now, hookah and vaping, people consider them as very benign.
Yeah,
Oh,
right.
I'm not
It
smoking.
doesn't
I'm just,
happen, yeah.
yeah, I'm
There are
just,
quite filtered kind of inhaling in
yes,
that.
yes. So I'm just vaping, right? And I have seen moms dropping their kids to hookah party, right? And then they sit all around and then they do hookah every time. But it is, trust me, it is far more dangerous than smoking.
Really.
Far, far more dangerous than smoking. And I'll take 5 minutes to explain each one of them. See, what is happening is that when you're smoking cigarette, then you know everything. You know that how many cigarettes are you smoking in a day. You also know that X amount of cigarette for Y amount of years causes cancer, it causes lung damage, it causes heart attack and other stuff. You are aware. When you buy a packet of cigarette, you know that this is the choice that you have made despite of all the problems that the cigarette has, right?
Right.
So that's your choice, your life. I'm not saying that you must, or neither I am encouraging smoking, but I'm saying that you know it, right? The government has also put a lot of dirty pictures on the packets. So you know that, right? But in cases of vaping, there's no such advice, right? And people who are vaping, they feel that since there is no advice and the
Proceed with
social
the same,
media, yeah, and social media is sort of not so against it. And as I told you that, there is a social acceptability regarding vaping against the smoking. If you see your kid smoking,
Yeah.
you will say, "Oh my God, what are you doing?" And you'll try and convince him to quit smoke. But if you see your kid, or I have seen mothers not challenging or not confronting their kids when they have found that they are vaping. That's wrong. Because it has got social acceptability, number one, because there is no count of it. You know, if you're smoking from morning to evening, you know that you have smoked about 10 cigarettes or 15 cigarettes. But when you're vaping, you don't know how many cigarettes have you smoked, right? Because there is no counter to it. How many puffs have you taken? So you keep on endlessly taking it, right? There is a social acceptability and you look more swag. You have a swag of vaping. So you tend to smoke more. And this is on top of the that you don't know what are you smoking. In cigarette, you know that there is tar, there is nicotine, there is lead, there is heavy metals, this and that. You know that, but in vaping, you don't know what are you vaping, what are you smoking. And these canisters are usually made by small time manufacturers in the dark lanes of Delhi and other cities, right? And they don't have any moral ground. Neither it is written on those vapes that, okay, it contains this much amount of
There
lead.
is no health advisory on
There is
that.
no health advisory on this. So we don't know what is the content. I don't know whether this vaping wala is putting paint or phenyl or naphthalene or poison or maybe heroin or charas into this. We don't know. So one, we don't know what are we vaping. Number two, we don't know what are the ill effects of vaping. Number three, there is no stopping us. We keep on, for example, in hookah parties, you know, there are 10 people, they will encircle, make a circle, and the hookah will keep on revolving one after the other, right? So, with the same pipe. So, definitely transmission of the disease is there, but even when he is not actively inhaling this, he is still inhaling the atmospheric area. It's all filled with fume. It looks dingy, right? And we don't know what's in there and what are they smoking. Trust me, the cigarette, it took about good 80 to 100 years before the scientists could pinpoint the association of smoking with lung cancer, or smoking with COPD, or smoking with heart problem. It took them about 60, 70, 80 years, right? the vaping culture is just started about 10 years ago. So
So very
70 years from now, we'll have studies which will tell us that how bad this vaping was, right? Till that time, it will be too late. And I will advise strongly against vaping and hookah.
quite an eye-opening, Dr. Ashish, and thank you so much. Dealing with all these things, special consideration for patient with lung conditions.
Lung condition, usually the patients like COPD, asthma, ILD, these are the patients they tend to have, you know, increased requirement of the medication. They become more symptomatic when they are exposed to these pollutants, and they must consider the advice of their doctor, and the doctor may want them to increase the frequency of the inhalers and many other medications. Sometimes the patients may need some steroids also, but my black box advice would be not to buy their own medication over the counter. Must go and visit the doctor
First,
and the doctor may prescribe you steroids. Then it is safe for you to take the medication for that prescribed
yeah,
duration.
these days it's very common. People go to the pharmacy and they give their problem and ask the pharmacist to please suggest. Yeah.
Yeah, exactly.
So, how should individual with chronic respiratory conditions like asthma or COPD manage their symptoms during the winter invasion?
So again, you may have to increase the frequency of the inhalers. Those on the inhalers may be shifted to nebulizers for some time so that they get a better drug delivery. That is the second thing. There are patients. Please keep on checking your oxygen saturation with the pulse oximeter, because if your respiratory problem increases, then it is possible that your oxygen saturation may go down. Plus, if you have coexistent viral infection, then also your oxygen saturation may go down. So you keep on checking this. Those with a suboptimal oxygen level may be asked to put on home oxygen, right? So some patients they need this. Some patients with this COPD and obstructive sleep apnea may need a special device like the CPAP machine and the BiPAP machine, right? So I think they should visit their doctor and take the proper consultation, and the doctor may advise them from the spectrum of these medications.
Okay. So, what are the government and public health measures in this?
See, government, who am I to advise
what government role plays in this?
The government role is to control the pollution. I don't know why we are not discussing this during the election rallies, right? During the election, if this becomes a prominent problem on which we vote, right, then definitely the government will listen. But there are certain measures that the governments they do take, but these are more reactionary rather than the preventive things, right? Like they should start acting now to prevent a September October pollution rather than waking up in September and October. By the time the damage has already been done.
Will that odd even formula work? That's the only famous thing to prevent the pollution here.
Yes, odd even is one thing. They stop the constructions and all these things. They take Parali, which is very infamous. They've stopped firecrackers in Delhi. So all these things they do take into consideration. But I think much more needs to be done than just doing this.
I mean to ask, are there any community or public health initiatives that people can participate in to reducing pollution or its effect?
See, general public, first of all, as I said, that for general public to make it happen, then they should ask their corporators, administrators, legislatures, member of parliaments to ensure and make the policy for the pollution, right? To curb the pollution. That is one thing. The second thing is then, yes, definitely we should use more of public transport. We must ensure that we get our vehicle certified with PUC. So my own vehicle is not polluting that much. Number three, carpooling is a very good example. One can do. So instead of four cars on a road, there is only one car, less pollution, less traffic jam. These are the things that they can do. The generators, they exhaust the exhaust of the generator is very dangerous, and so one must not use the generator. The problem is that we don't have 24 hours electricity supply, so the general public is sort of forced to use these things, and that's why the onus is more on the government than on the general public.
Okay. So, so we have some questions from the Women Entrepreneurship platform here. They have some questions we'd like to ask you. What are the initial signs of lung damage caused by pollution?
So, lung damage, I'm not sure what do they mean by lung damage, but if the lung is affected because of the pollution, then initially you do have problems like sneezing, coughing, throat pain, breathlessness. These are the things. But if you are in constant, uh, under polluted atmosphere and high AQI level, then definitely uh, even when you are out of that, when the weather changes, when the pollution levels it drops down, then then also you continue to be breathless, then also you continue to be feel exhausted, then also you continue to have low oxygen levels, and these are the things that suggest that probably your lungs have a little sort of damage
Has been asked. Okay.
they
The
have asked.
second question from them is, can passive smoking equally damage the lungs?
Oh yes. I won't say equally, but it is quite an important thing, right? The passive smoking or the side stream smoke, as we call this, um, does have uh, or is equally hazardous for the person who is not smoking,
Okay.
right? Uh, so when I see my patient, I have got a zero tolerance when uh, the spouse of my patient tells me that the patient smokes in the room or in the house.
Like I cannot
You know,
enter that.
they say that even in the house the person is smoking, and that's sort of a zero tolerance for me, and I very sternly and strongly advise my patients that if you have to smoke, that's your choice. You want to smoke despite of knowing all the ill effects of smoking, right? Then you go out and smoke, right? Why should you affect the
Others.
person who is decided not to smoke?
Correct.
Right? We must respect their choice also. We must also respect their apprehension and they are taking care of their body by not smoking. So you should not. So I will strongly recommend that number one, if you first of all do not smoke, you must not smoke. But even if you have to smoke, do not smoke inside the house. There are young kids, there are other family members, those who are not smoking, and why should they bear the brunt of this? And therefore, even in the hotels and the other places, you see the no smoking areas and a designated smoking area. And the reason is same, because the side stream smoke, the passive smoke, also cause harmful effect, and they can range from all the simple throat pain or exacerbation of asthma or breathing problems. It can aggravate, so one must not do this.
Okay, the last question from them is this: what precautions should people with asthma or COPD take during weather changes?
So since we have covered the general this thing, but specifically for the patients with the asthma and COPD, I would advise a couple of things. Number one is that please visit your doctor. Please go and see your doctor before the pollution and before the winter season starts. So starting from now till up till Dashera is a good time. The pollution usually starts after Dashera. The temperature also starts dropping after Dashera. So this is a good time for you to go and visit the doctor and make a plan for next 3, 4, 5 months as to what they should do. Number one, and number two is keep your medicines at hand.
Yeah.
Keep the inhalers handy, and because you may need them anytime. That is the second thing. The third thing that I would advise is that you must take the pneumococcal and the influenza vaccine. These are the vaccine for the influenza as well as for the pneumonia thing. And um, the influenza vaccine is to be taken in especially for the senior citizen people, once every year for 4 years to get the best results. And the pneumococcal vaccine is usually taken once in 5 years or once in the rest of the life. So all these things are there, and that they have to take care. But yes, they must talk to the doctor. They must visit the doctor, and all the other general symptoms that we have discussed, they are always there. Like if you can afford, then having an air purifier. Then if you can, you must drink plenty of water,
Water,
eat fresh fruits, and all that can be eaten raw, and and do some exercise.
Yeah, that's very
every day.
necessary.
Yeah.
So here we come to the closing advice. What final advice would you give to the residents of Delhi on maintaining lung health during the winter pollution season?
So for maintaining the lung health, it is important that you should not consider only maintaining the lung health during the winter season or during the pollution season. You must practice throughout the year so that you can have a better lung health during the winter season and the pollution. So the preparation does not start in September; it starts in February and March. You should again, for the sake of repetition, let me do it once again. You must drink plenty of water, eat fresh fruits and vegetable, do exercise, do the breathing exercises like pranayam, yoga, and visit your doctor if there is any problem. If there is any, if you are asthmatic, if you are a COPD patient, you must take the inhalers properly. Then, if you're a smoker, please quit smoking. That will help you. No smoking, no vaping. That is important. And stress upon your governments to uh, curb the pollution.
Thank you so much, Dr. Ashish Jain. It was very insightful and rather very good discussion with you on this pollution diseases we face while winter approaches daily. Thank you so much.
Thank you very much. Thank you.